More than a quarter of the world's population is affected by soil-transmitted helminths. These are worms. Limited access to sanitation and therefore contamination of soil with human waste is one of the leading contributors to this problem. My name is Dr. Mercy Korir. I visited Kisumu and Busia counties to bring you a first-hand experience on what the school-based deworming program has done in order to reduce the burden of worms. Barefoot or with shoes, the pupils at Rabor Primary School, which started in 1956, enjoy their playtime oblivious of the roving camera crew.
After I took the medicine, I didn't experience stomach pains and I felt good. Sometimes I even liked to eat so many foods after I took the medicine. Yeah.
Dorcas Opio, the last born of 6 girls, has never missed any deworming exercise since she started school. Like her classmates, 14-year-old Michael Duncan and 12-year-old Adrian Wilson, the deworming exercise has given them a chance to pursue their dreams undisturbed by illness.
So far, I have attended the exercise for just like 7 years.
The food I ate before deworming and after deworming, it reduced a little bit.
Initially, parents in the school had been reluctant to participate in the program. This was made worse when children did not tolerate praziquantel, one of the medicines against schistosomiasis, bilharzia. But with time and continued sensitization, the community has embraced deworming.
They used to have stomach problems. At times, they were not coming to school. You take them to the hospital, you know, that is another expense. On top, you buy books, that is another expense. But nowadays, I can take them to the hospital because of other illnesses, but not the illnesses related to water, like the bilharzia. I've seen some improvement and they're doing well. Yeah.
Moses Ouma is a proud father whose daughter managed to excel from here to make it to the next steps in secondary school.
I had one of my girls here, did KCPE the other year, and now she did well. She's in Near Girls, a national school, and I'm proud of that because of this deworming.
In 2012, the Ministries of Health and Education entered into a 5-year program implementation and partnership framework agreement with Evidence Action to scale deworming across all identified at-risk counties to reach an estimated 6.7 million children aged 2 to 14 for soil-transmitted helminths and bilharzia. Rabor area in Kadibo sub-county in Kisumu is prone to flooding and the risk of bilharzia caused by parasitic worms that thrive in fresh water contaminated by human feces.
The rate of the infection of the worms, I think, has gone down. The school attendance, we do not experience a lot of absenteeism because of children being out after infection of by the worms. I think also the child population of this school has really improved. What it was in those days, about 640, and today we are talking about 1,154 pupils. I think this is a great impact, and I want to attribute this to the deworming that has been done to the children.
Because of regular school attendance, he says, the performance of the school has improved drastically.
The rate of the infection of the worms, I think, has gone down. The school attendance, we do not experience a lot of absenteeism because of children being out after infection of by the worms. I think also the child population of this school has really improved. What it was in those days, about 640, and today we are talking about 1,154 pupils. I think this is a great impact, and I want to attribute this to the deworming that has been done to the children.
According to the World Health Organization, soil-transmitted helminths, commonly caused by roundworms, hookworms and whipworms, are transmitted by eggs present in human feces that contaminate the soil in areas with poor sanitation. School-age children from 5 to 15 years bear the biggest brunt of the worm burden. Experts say they harbor 70 to 80% of the disease burden, being affected nutritionally and physically.
As a country, the worm burden is mostly found in Western Kenya, in Luo Nyanza, in some parts of Rift Valley, and at the coast. Other areas like northeastern or northern Kenya are too dry for worms to survive. But where we have dense population and a lot of agricultural productivity, that is where the worms are most prevalent, and that's where mainly the problem is.
Busia County is one of those most affected counties in Western Kenya. St. Mary's Nambale Primary School in Busia County has been around since 1974.
I've been taking it since I was in PP1 until now in Standard 7.
With a population of 1,453 pupils, the National School-Based Deworming Program has been a success. Helen Kisayo, who would one day want to be a neurosurgeon, is positive about the benefits of the deworming program.
I'm always okay when the teacher speaks. I'm alert. I don't always get sick all of the times, or maybe feeling a stomach ache. And not many times my mom takes me to the hospital.
Julian Anyango is a 42-year-old mother of 7, the eldest in 3rd year of university and the youngest in PP1. 5 of her children schooled here at St. Mary's Nambale Primary School.
Mtoto akiwa dewormed, afya yake inakuwa nzuri. Na pia anakuwa attentive wakati wa darasa. Na pia hawezi kukosa shule. Ikiwa wakati wa shule hawezi kosa kwa sababu ako pengine na shida fulani ya afya.
Julian's 2 eldest children are in university, while 3 others are in secondary schools. She attributes this progress to the deworming program.
Wali improve kwa sababu ukiona hao watoto wote kama wale wa kwanza, hakuna yule ambao ninaweza sema alianguka mtihani. Wote waliperform vizuri na wakaenda hata kwa shule nzuri.
Implemented in sub-counties, the program's goals is to eliminate worms as a public health problem for children in Kenya. But initially, what the implementers saw in the course of treatment almost derailed the exercise.
At first, when we began 10 years back, so many children vomited and even diarrheaed. They were diarrheaing worms. I witnessed. It was around 2012. Huh? Yeah. Many children had big stomachs. Many of them, after the first drug, they had a serious diarrhea and even vomiting. Some worms were coming through the mouth during the first deworming. Second time, they had lessened. But as we have continued, the children are now okay and they are used to it.
Other students fear the drugs because they think it is for other purpose, but the drug is just for helping us to reduce the parasites inside our bodies.
People alleged they are bringing devil worshipping to give to our children, so some of them were resisting. But with the sensitization during parents' meetings, we normally sensitize them and tell them let children take drugs, because these drugs have a good impact on them.
Okay. Science has proven that there is an economic benefit of deworming. This is because of the direct relationship between deworming and the performance of children in school.
Recent studies has also indicated that, beyond just the health and, academic outcomes that it has. It also has economic impact. And as a country, the study indicates that adults who received 2 or 3 more rounds of deworming get higher income, up to 13% more than the ones who did not.
The program will aim to treat 80% or more of preschool age and school age children within all endemic areas. All children aged 2 to 14, whether enrolled and non-enrolled, are eligible for treatment. Though the program is managed at the national level, it is implemented locally by trained county, sub-county and division or ward personnel, including teachers at the school level, who are responsible for key elements of the program's success.
First, there is the national training of master trainers who are drawn from the different counties that are participating. They are taken to a central place for training, all of them. Then now the master trainers from each county cascade the training to the sub-counties in their counties. So we hold a 2 days training for the sub-county trainers, drawn from the Ministry of Education and Ministry of Health.
These sub-county trainers, together with the division trainers, are then responsible for training teachers like Juma Agneta, the in charge of health programs at St. Mary's Primary School, Nambale.
We are normally called at the sub-county office. We are briefed on what to do. We are given drugs, and a specific date is set. Then when I come back to school, I also have to synthesize my colleagues on what is supposed to be done on the deworming day. Each class teacher is issued with a sheet to write on the learners' names. They list down all the names in the register. Then I brief them on what is to be done. If a child takes a drug, we normally give a tick. If the child is absent, we give a 0. And if a child happens not to want to take that drug, we normally put an X because has not taken. Then we also advise them, if a drug happens to fall down, they are not supposed to pick and give to a child. Then if a child has any sickness, I advise not to be given, because some parents may assume that it is the deworming drug that has caused the sickness. So we advise that it will be given when the child is well.
A child who develops any complications rests in a cool place, often under a tree as they are observed. No child, she says, is forced to take the medicine when they decline.
Last year alone, we administered 284,000 albendazole drugs. This year, we are likely to do 350,000. So if you put in quantity, that goes to millions of money. But we have not had any shortage of the drugs. The Minister of Health, together with the Minister of Education, at the headquarters level, ensure that what we request, we normally get it. In fact, above all, even with a buffer stock.
Busia Chief Officer in charge of Health and Sanitation, Jonathan Eno, says the communities in Busia are now aware that they need to deworm at least twice a year. Some even do it every 3 months.
At one time, parasitic infections was among the top 10 conditions that were experiencing, which were causing morbidity within that cohort population of 2 to 14 years. So as of now, the parasitic infections now are doing at position 8, and at that time it was around position 3. So there has been drastic reduction in parasitic infections.
But reaching here, he says, has been fraught with myths and misconceptions. Many thought the medicines were a form of birth control, a misconception that might have derailed the program. But they dispelled these myths.
The teacher-people relationship is so strong that the pupils have got a lot of confidence among teachers.
The deworming treatment has taken place in 27 counties, 145 sub-counties, and in over 16,000 primary schools.
We've been relying only on chemotherapy, treating. Apart from chemotherapy, we need to also make sure that we have good sanitation and we have usable water, safe water, and that the people also have adequate education so that they can observe hygienic conditions in the environment.
Dr. Mondawiro is in charge of the team doing monitoring and evaluation of the deworming program from inception. While COVID-19 partially disrupted the program, he says it was a blessing in disguise in that the regular hand washing and strict sanitation requirements might have accelerated the decline of the worm burden. Busia, for example, declared an open defecation-free county in 2015, has been observing water, sanitation and hygiene standards according to its Chief Officer of Health.
We try as much as possible to improve our sanitation status. And that is through ensuring that people have got a good supply of water and the water which should be safe. And then we ensure that we treat water at the household level, at the point of consumption, which should be very key. Then ensuring that the community or the county has got good coverage of sanitation facilities, basically starting from the lowest, which is a pit latrine, and then to consistently make use of those pit latrines.
Sarah Yumba is the Nambale Sub-County Director of Education in Busia County. She says that they have recorded more than 95% coverage in deworming.
We capture all institutions, both public and private, which is also a very good thing. We have been able to cover even all the ECD centers within the sub-county. So that has been an advantage to the deworming program because it can be able to reach even the private institutions.
We have seen high enrollment in school. We have seen high performance among the learners. Absenteeism has reduced.
Deworming is an integral part of the school health policy, as explained by Dr. Christine Wambugu, the head of the Division of Adolescent and School Health at the Ministry of Health.
And towards this, we have a joint school health policy that has 8 thematic areas. And deworming comes under the thematic area of communicable and non-communicable disease control within the school environment.
As part of this policy, deworming also finds its way into the day-to-day activities and studies of the learners.
Through the school health programs, through the topics, the curriculum that we have introduced, and especially now that we have hygiene, we have science and hygiene. So you'll find it incorporated in those.
Already we have an existing policy, school health policy, and the school health policy is supposed to be adhered to everybody who is in the education sector, especially in our schools. That's why you can see in our schools we even have the healthy clubs.
Deworming is not an intervention that we give on its own. It has to go hand in hand with water, sanitation and hygiene within the schools, so that even as we are giving the treatment, we are preventing reinfection of the students by ensuring adequate standards for water, sanitation and hygiene.
Kenya's Vision 2030, the economic blueprint to make the country a middle-income economy by the year 2030, singled out deworming as one of the high-impact interventions under the social pillar. Nerea Olik, the Director of Primary Education at the Ministry of Education, has worked in this program since 2009.
It has increased the cognitive ability of the learners, and generally it has impacted very positively in their outcome of their learning areas.
There's also research that shows that when learners remain healthy, when you deworm them, then even their cognitive ability, their ability to grasp what is being said in school, their ability to interact with others, and their ability to be confident to go to school and undertake learning is very high. And so that collaboration with the Minister of Health, in my view, is one of the best you can get. And we don't take it for granted, because this then means that you have so many learners that can spend time in school. It also reduces, I think, the cost of healthcare, because if they are not dewormed and therefore they become unhealthy or they become unwell, it means the parents and the government, by extension, will be spending again another amount of money in getting them treated. As you get learners treated, you also have parents spending more time that they would use in productive work.
Research shows that if deworming is not done, there is up to 25% absenteeism by learners, something which greatly affects their overall performance.
Because of elimination of the worms, nutrient, micronutrient and nutrient absorption is also increased, therefore increasing the overall nutrition situation of the child.
There's a lot more ahead for stakeholders to ensure coverage of all children to meet the WHO threshold of under 2% prevalence of worms across the country.
The evident action has given a lead in the technical areas, and we have enjoyed the partnership, and we are only asking if we can continue and enhance it more than what we have done, because so far currently we are covering 27 counties and 166 sub-counties. Annually, we normally deworm 6 million learners. Our target is to cover the national coverage, to have a national coverage of the 8.something million learners annually.
During planning, it's important to ensure that we do a lot of sensitization, because sometimes maybe on the deworming day, because that's when we capture our data, it's important we do more sensitization before the day of deworming. And by so doing, we shall ensure that all children are in school so that they are all reached.
Through the Ministry of Education, we have ensured that we have aligned data collection systems through the NEMIS and the National Health Information System, the KDHIS, so that both sets of data speak to each other, so that we do not have to rely on partners or other players to get the data for planning.
At the start of this deworming program 10 years ago, 3 in every 10 children had a problem with worms. This had reduced to 1 in every 10 children by year 6 of the implementation. These numbers are expected to be much less once year 10 surveys are done.
The program targets to treat 6 million children annually, and we have been able to meet the target across all the 9 years that we have operated, other than in 2020 when we had COVID disruptions and we were able to reach only 3 million children. So generally the program has been able to surpass the WHO 75% threshold in terms of the target for school-age children who are treated.
To increase coverage and ensure everyone who needs to be treated is treated, a change of strategy to include children out of school, preschool-age children and mothers of reproductive age may be necessary.
We have only been doing the school-based approach. Some countries, they do the community-based approach. What we need to do is to combine the two. Research, data and information has informed us that the school-based approach alone cannot bring us to the elimination stage.
Dr. Mandawira and team collect stool samples which are then examined for evidence of worms. While he reports that there has been a steady decline of infection, counties differ and the rate of reduction is not as uniform across counties as expected.
When we started, a county like Narok was at 50% prevalence rate. It has only come down in 2018 when we did our last comprehensive survey. It had come down to about 40%. A county like Taita Taveta, which has the lowest, is now below 1%. So now Taita Taveta can be excluded for annual treatment of children, but then surveillance has to be done.
Different counties, he says, have different lifestyles and usage of latrines, some with poorer water, sanitation and hygiene conditions, but he also does not exclude the possibility of drug resistance. To eliminate worms, he recommends that the country needs to do remapping of the program to include previously left out areas.
Nairobi was left out when the program started because Nairobi was found to have no worms. At the moment, recent research has shown that we have worms in Nairobi, especially in the slums, in Kibera, in Korogosho and others.
To achieve all these, according to the Principal Secretary, Ministry of Health, the government is allocating resources to the program in addition to the donor support.
The government has taken full
responsibility and is gradually, preparing itself to gradually transition out of, complete donor support.
Kenya's Ministry of Health allocated 70 million shillings to the deworming program this year, a program estimated to cost less than $50 at 50 Kenya shillings per child per year.
And to make the program sustainable, we have to have some budget lines to begin with. Have some budget lines on deworming, both at national government and at county level.
In addition to us allocating funds for deworming, we are also going further to ensure that all the resources of the government that are directed towards procuring dewormers goes to local manufacturers.
To accelerate the elimination of worms, the stakeholders called for more civic education for teachers and parents through different forums like in schools and barazas, in addition to commensurate budgetary allocation to support these activities.
I would want to say that the government is fully committed to keep us on the path of sustaining the program, and the funding will continue to be increased to ensure that we fully own this program and we fully finance it as a country.
Globally, diarrhea and other gastrointestinal diseases claim the lives of 1.6 million children. Deworming plays a major role in reducing these deaths, but it is not only in the reduction of deaths, but ensuring that these children attend school, perform optimally and live to their fullest potential. Dr. Masi Korir for KTN News.